Hello friends, welcome to Creative Medicine. In this lecture, we will learn about increased suicidal tendency is associated with decreased serotonin. Especially decreased serotonin is seen. This decreased serotonin is responsible for increased suicidal tendencies. This is actually found out by determining or detecting the decreased levels of 5-hydroxy-indole acetic acid, which is a metabolite of serotonin. So this decreased levels of 5-hydroxy-indole acetic acid is also related to increased risk of suicide. Thank you and thank you for watching.